Hi. If you're worried about your knee pain and it's not getting better, you've tried exercises, you've tried some medicine from your family doctor, you've tried some YouTube videos, you've listened to your family, your friends, your coworkers, and this darn knee pain is stubborn, it's not getting better. You've tried some treatments with other healthcare professionals and there didn't seem to be a full resolution of the knee pain. Or you're just searching diligently for some great advice on knee pain, and you've come to the right place. So I'd like to welcome you to the Nose Creek Sport Physiotherapy website, where we get you moving faster and feeling better is our team sort of slogan, and where we love treating patients over 40 that have persistent knee pain or some pain in their knees that just isn't going away for a variety of different reasons, and maybe reasons they haven't yet discovered. So um, often what we like to do is just start with why this whole knee pain has started, and how we can give you the best advice possible to sort of get you started in your recovery. And so my name is Blair Shakti. I'm a physiotherapist that has worked with patients just like you over the last 25 years, and I've established a business here in Calgary for over the last 17 years that's worked closely with, again, clients over age 40 that have ongoing knee pain that's not getting better, and that they've tried medicine. They've seen their family doctor. The doctor said, okay, we need to rest. We need to take these pills. Let's see how it goes. Come back in 6 weeks if it's not any better. And quite often, they've done different medical interventions, but they haven't done a lot of active rehabilitation with the joint itself and the muscles and the tendons, and really it just needs to be pushed to its full potential. So what we try to do is take people like yourself that are probably pretty skeptical at this point because you've tried different things and doesn't feel like it's getting any better. And often I know why you're skeptical, because you've probably had some bad advice, over the years that's really not led you down the right path to recovery. So, what I encourage you to do is to, um, you know, engage in some exercises, but often the secret to the exercises is we have to make sure that they're the right type of exercises, um, and that it's given to the right condition. So, an example um, of a couple of my patients just recently, one lady even said to me, we did about 4 sessions together on her anterior chronic knee pain and sort of medial knee pain on the inside of her knee, and she said to me, "Oh my God, Blair." And I'm like, "What?" She goes, "My pain today, I just realized, is about 50% less than it was when we started. And I've done activities that I normally wouldn't do, but like I wouldn't have done before I met you." And so she said to me, "I should have been sent here 10 years ago. Like, I really have missed out on doing a lot of fun activities the last 10 years because I was scared to push this knee that just was giving me chronic knee pain and slowing me down. And anytime I tried to push the knee, it actually got worse. And so it was like a light bulb went on in her brain, and she's like, "Oh my goodness, I'm so glad I attended. Like, I just feel like I've got young knees now and I can do a lot more stuff now." And again, that was a simple knee condition that just wasn't referred on, was seen by the physician. The physician even told her, he said, "Well, you've got arthritis, there's nothing we can do. We just have to wait till your inevitable kind of joint replacement down the road. So you just got to live with it." And fortunately, she was talking to a family friend that had been to our clinic, and she was like, "We should really go see Nose Creek," and because they really helped my knee pain as well. And so she came in, and now she's back to a fitness program. She's losing weight. She's just so excited to regain her fountain of youth, we jokingly call it, with her. So these are some of the success stories that we hear from what I call conditions that just aren't properly managed. They're not really difficult conditions to treat or to manage, but they just have to be given the proper advice, the proper exercise program, at the right time and the right dosage, the right amount, so that the joint and the muscles and the tendons can slowly make that recovery to sort of that pain-free state. Yes, you can take pills and you can go to bed and rest and, hope the next day that it's going to get better. The hope strategy can go on for like 5 years and you're still not better. So, it's something that I think hope isn't a great strategy. The next one is avoidance. A lot of my patients will say, "Well, it hurt to squat down or it hurt to kneel on my knee. So, I just quit doing that, or it hurt to pivot, so I just stopped running, or I stopped playing soccer, with my kids because my knee was just bugging me every time I tried to play soccer." And so what happens with the avoidance sort of strategy is, you make a mental note of what makes it worse, what activities the knee doesn't like, and then you stop doing those. But the problem with stop doing those is it's reducing your overall activity level, which is making you less active. You're not keeping your cardiovascular fitness up. You're starting to gain weight. Now you're getting high blood pressure. It's just like a downward spiral. As we get older, if we don't stay active and keep our engine moving, and our body moving, then we're not going to be very mobile in our golden years and really enjoy our retirement. So very important to treat these joint and muscle injuries and get them rehabilitated fully so you can get back to a normal level of activity to stay healthy. The doctor might say, take these pills for pain management. And by the way, you're getting old. You're just going to have to live with it. Don't accept that. There are solutions out there for you, especially if you haven't done any real true rehab on that knee joint. We help and serve thousands of people just like you with your knee pain on a daily and a monthly basis. And I think it's really important to just not fall into that trap of, you're getting old, just accept it. Oh, you got bad genes, all these sort of things that come up. And I call them just excuses that really aren't reality. They aren't true. So the reality is, even if you got like 10, 20, 30, 40% pain relief just with doing some really simple stretches. I mean, imagine that. Imagine coming in, doing an assessment and getting a little bit of relief that day or the next day just from some simple stretches that your therapist taught you that were very specific to your joint condition. Imagine stopping your pain medications so that you're not getting any side effects from into your internal organs with all the medicine you're taking. Imagine being able to, walk, run, climb stairs, go downstairs, squat, play with your kids, play with your grandkids if you're older. And not have a lot of anterior or knee pain or pain inside the knee that's really bugging you. Not having those deep dull aches every morning when you get up. Trying to basically manage it better so that you can stay more active. And you probably can't do that right now just due to your current pain. So whatever your story is, I'm sure we've heard it in the clinic on a regular basis. And what we like to do is, start with the why. So why did this occur? What caused it? What are your modifiable risk factors that we can look at, we can address, we can change over the next little while, and offer you a comprehensive treatment plan that will take you sort of to the next level of your function and reduce your pain down so that you can enjoy life a little bit more. And basically return to work, return to play, return to your favorite exercise class, return to more independent life, And some of my older clients will say, well, I just don't want my son or my daughter to have to do this for me anymore. I'd rather just, if you could just fix my knee, Blair, then I could go out and I could mow the lawn, or I could, do the activities around the yard that I seem to can't, not be able to do. And so if any of this is starting to sound familiar to you, and you want to reduce your pain pills, you want to get back to, pain-free function in day-to-day life, just with walking, and using your knee, on a regular basis, we can certainly help you. And the way we'd like to help you is just engage you in a conversation. So one thing you can do is you can just give us a call and book an appointment to talk with the physiotherapist, one of our great team members, for 15 to 20 minutes. And quite often, you can ask your concerning questions. You can ask the questions that the doctor probably didn't have time to address with you because you only get about 5 minutes with your family doctor. We're willing to sit with you and really listen to you because we have the time for you for 15 to 20 minutes, and then we'll basically at the end of that know whether we can help you or not. We can see if there's some modified risk factors likely there that we can make a difference with. At that point, if you feel comfortable that you made the right choice engaging with us, then you can just simply ask our team to become a member or a client of ours at the clinic. Alternatively, if you are happy with this information, you've tried some information on the website that's made a benefit to you already, you're really just eager to get going and you're motivated to make a change in your knee pain, just click on the cost and availability button on the website, and there'll be some forms you have to download and basically fill in for us, and then we'll contact you and we'll try to get you in within the next couple of days. And then the third way that you can contact us is through what we call a discovery session. So if you're incredibly nervous and very skeptical, you've had some bad experiences in the past with your knee pain that didn't get better or got worse, for example, then we can certainly meet with you one-on-one, face-to-face, and you can talk to the physiotherapist. We can definitely sort you out and have a look at what's concerning you, and what might be modifiable risk factors that we can change within your knee function or your knee condition. And then at that point, if you're comfortable, we can basically start the journey in the recovery with you. Once you've been into our environment, met the physiotherapist, and you see what a caring environment we have, away you go, and let's get going. Let's see if we can't make a difference in that pain. And so the big difference is we have time for you, and we're willing to invest a bit of time into you and sort of figure out what your needs are and really try to help you along the way. And again, the 3 ways you can get in touch with us is cost and availability button. And then the next one would be the telephone conversation if you've got more burning questions that you want answered before you start. Or if you're really nervous and skeptical, we have the discovery session, which will help sort out kind of if we can or cannot help you. And then again, you can come in and meet the staff and just check out the great caring environment we have within our clinic. So hopefully we'll get to help you sooner rather than later, and we'd love to serve you, and you can engage with us in any of those 3 ways that you feel comfortable with. And then I hope to see you in the clinic soon, and I'd just like to say take care. My name is Blair Shakti on behalf of the Nose Creek Sport Physiotherapy team, where we get you moving faster and feeling better. All right, take care, and I'll see you in the clinic soon. Bye-bye.